We have just removed the skin from the right hemi-abdomen. And what are the layers found below the skin? We have superficial fascia, and the superficial fascia is retained partly in this area, while in the other areas it was removed together with the skin. The superficial fascia of the abdomen has two distinctive layers. The outer layer is made up of loose connective tissue, and this layer can be infiltrated by fat, as you can see here. So the fatty layer of the superficial fascia is known as the Camper's fascia. On the deeper side of that, you have a more organized, dense connective tissue layer, which is the Scarpa's fascia. So below the superficial fascia, we have the deep fascia of the abdomen. Now, this deep fascia actually continues down below the inguinal ligament, and it blends with the fascia lata, which is a thick and highly organized deep fascial structure for the thigh region. So immediately lateral to the midline, you can see right there, not clearly visible at this moment, but you can see the vertically positioned fibers of the rectus abdominis muscle. The lateral margin or border of the muscle is the linea semilunaris. And then here you can see muscle fibers which are obliquely positioned. Those are the fibers of the external oblique muscle of the anterolateral abdominal wall. So the muscle fibers will reach up to the area of the linea semilunaris, and then the aponeurosis or the broad tendon of external oblique will form part of the anterior rectus sheath, which will wrap in front of the rectus abdominis muscle. That's why the muscle fibers are not clearly visible at this time. Then let's go down here. Let's go to the inguinal region. So in this area, right here, you can see there is a defect. So that is still part of the external oblique aponeurosis, but right in this area, you can see some sort of defect or opening in the aponeurosis where the spermatic cord will come out. That defect is called the superficial inguinal ring. The defect is described as a triangular shaped defect. So your ring is not really a rounded, or the ring is not round in shape. Somewhat triangular. The base of your triangle should be right there. So the opening will allow the spermatic cord to pass and reach the scrotal sac right here. The spermatic cord will carry important structures such as the testicular artery coming from inside the abdomen, specifically from the aorta. It will also transmit the testicular veins coming from the testis here inside the scrotum, going back inside. And from the testis also, it will transmit the vas deferens, the conduction tube for sperm cells. The sperm cells are manufactured in the testis.